Good afternoon to everyone and welcome to today's session. 30 MCQs in surgery rapid fire. When you play as a quiz, when you're a player, your mind is all challenged. The moment your mind is challenged, you will remember, especially when your companion is getting the better score, superseding you. That is how the learning begins. In fact, a lot of students join for the full-scale grand test series. But all of us suffer from the syndrome of postponement. कल करेंगे, परसों करेंगे, अरे बाद में करेंगे, ऑनलाइन में मिल जाएगा ना. No. You need to accumulate yourself, sit in a place, fight it, solve it, then get the practice. That is most important. That is the reason even tomorrow, every Sunday we have a grand test containing 300 MCQs, just like the NEET PG exam pattern. But what I observe is, if 500 students enroll for the online test series, only 5 or 6 people will actually solve the paper on the Sunday. That's not right. So that is the reason what we thought is, we will divide the 300 MCQs of the grand test into 6 parts, 50, 50, 50, 50, 50, 6 blocks. Every 50 question block, we will run it like a quiz. And there and then you can be able to answer and we can carry on discussion. That way you are solving all the 300 questions, you are also competing extempore. And that becomes a habit for you to prepare for the entrance exam. Because just by subscribing, the job is not over, right? So let us take up a edge of the seat excitement with this quiz contest. So all of you know very well, where is the all of you know very well how to buy the ticket, get the link of the page where you can join the game and can be able to play the game. Very good. I'm able to see almost 16 online. So it's a small payment of 50 rupees for which you can be able to play the game. And if you are a winner, you get a chance to get the 40,000 rupees of online mbbs.com video library, full-scale grand test, 1 lakh PowerPoint slides, etc. I'm only able to see Dr. Bhavya Dubey, Dr. Anubha Singh, only 2 players currently. Yeah. So shall we wait or shall we start is the question. So I hope you don't have any difficulty. Just you need to go to this payment link. I'm once more typing to you. You need to go to that payment link, buy the ticket, 50 rupees, join the game and play the quiz. So that is the plan. So it's a very simple thing. So let's make the great beginning, doctor, without much of wastage of time. Yes. Anubha and Dr. Bhavya, I hope you both are ready. Let's start the quiz. You have 10 seconds of time to answer. False about seminoma. If the median age is 4th decade, Is the seminoma radiosensitive? What is the radiotherapy? Is the radiotherapy the treatment of choice? So you need to remember, since there are only two players, none of you could correctly answer. Seminomas are radiosensitive, no doubt about it. But radiotherapy is not the treatment of choice, is what you need to remember. So, yeah. Now, the next question. So, the median age is fourth decade. Surgery is the treatment of choice. Though the seminomas are radiosensitive, seminomas metastasize to lymphatics, and seminomas correspond to dysgerminomas of the ovary, is what you need to remember. Now, the next. Only we have one player and one topper of this quiz. So, Dr. Bhavya Dubey. Now, the next question. You need to answer very fast, Bhavya. The next question. A 6-month-old bought by his mother presents with the episodes of distress and crying, interspersed with quiet periods of normal behavior and playing. So what is your diagnosis? Excellent. One of you is right. You have this link. Please go to this link. Please go to this link. The moment you click this link, it will ask you to quickly pay 50 bucks. The moment you pay it, you will get a image for you to download. You download that image. In that you have the link, and you enter that link, you are into the game. So, two-step process. One is you need to make a payment and then get the game link and go to the game link, and then you can start playing. Okay? Even now, if you are slightly late, no worries. You can still be able to join. Right? Manasvi is saying, I'm not able to join. Manasvi, have you purchased the ticket? Could you get the link? There shouldn't be confusion. It's a very simple process. Like two of our students have done it much earlier, even before the show start. They have purchased and got the link, and now they are playing. Bhavya Dubey and Anubha Singh. So otherwise, Manasvi, please call 9000-868-356 and try to get the game link, right? Yeah. Now, the next question. A 30-year-old female has bloody discharge from the nipple. No other palpable masses are seen. So what is your diagnosis? Is it fibroadenoma, giant fibroadenoma, fibrocystic disease, or intraductal papilloma? Excellent. But none of you could answer. You have only 10 seconds window to answer. Be very sure, doctor. So, Bhavya is in the top position. Now, the next question. A 65-year-old male has an indolent, pale, raised, waxy skin mass on the bridge of the nose. The mass has been growing slowly over the past 4 years. Oh, the time is up, but only one of you correctly answered, and that is the correct answer, which is basal cell carcinoma. Excellent. That takes Dr. Anubha Singh rushing much faster than Dr. Bhavya. Now, A 65-year-old had sudden onset of a tearing chest pain radiating to the back. BP is 220 by 120 with unequal arm pressure, but normal cardiac enzymes. That is a very important clue. So what is your diagnosis, doc? Very good. Only one of you correctly answered. Dissecting aneurysm of the thoracic aorta typically has got this kind of a presentation is what you need to remember. Very good. Kim Jong is able to join the game. Excellent. So just like Kim, even if you joined the game little late, so oddity, please call our helpline 9000-868-356. If you have already paid, no worries, you can call our helpline and they will give you the link. Just use that link and you can now join. Even now you can join the game, right? Now. Very good. So Bhavya Dubey is on the top. The cyst trunk procedure, it is done for what? For which condition do you do cyst trunk procedure? Very good. 3 of you are right. All the 3, thyroglossal cyst is what you need to remember. Excellent. Now Kim Jong is really rushing forward. A 15-year-old girl has a round 1 centimeter mass on the side of the neck beneath and in front of sternocleidomastoid, which is the remnant of the second cleft. So what is your diagnosis? What is your diagnosis, doctor? Very good. Yes. Oh, this was given a lot of time. 2 of you are correct. Branchial cyst. Classically, the branchial cyst. Wow, that brings Kim to the 2nd position. Now, a 6-year-old presents with swelling, which is fluid-filled translucent mass in the supraclavicular area. What is it most likely to represent is a very important question. Only all the 3 of you are right. Classically, it is a case of cystic hygroma. Cystic hygroma. Excellent. Very good. Late but latest arrival is oddity. Let us see, oddity can make up a little delay. So doctor, let me tell you once more. The real excitement is when you join these rapid fire quizzes, play with everybody else, check how good you are, right? So that is the reason. Please first become a subscriber to our YouTube channel. The moment we plan an upcoming quiz tournament, we will upload it into the YouTube channel and give you a link. You need to click on the link. It will take you to a payment page to buy the ticket, 25 rupees or 50 rupees, whatever. So the moment you bought the ticket by making an online payment, it will give you one downloadable link of one image for you to download. The moment you download, you have the URL of the game. Just go to that URL when the quiz starts, choose a screen name and participate and play. But the only thing is, you need to do that before at least 1 hour before the quiz starts, so that there is no confusion, right? So we are in a little starting phase for you to understand this. Now, Raj Pardeshi is really asking a good question. Sir, please take the quiz free of cost. Oh, that I have done for the past 1 week, Pardeshi. Almost all 3 into 7, 21 quizzes we conducted freely. And we gave to the 21 toppers of each of the quiz a free subscription to 40,000 rupees worth to onlineMBBS.com, video library, full-scale grant tests and everything, right? So we are free in many ways, but sometimes if you pay a small ticket, play a quiz tournament, become a winner, or at least be in the top 5, you get the thrill, you know. For the thrill, you need to spend 25-50 rupees. There is no other option, right? You all agree with me? So once more today evening at 7 p.m. we have a very, very interesting rapid fire NEET PG quiz. Please participate. After 1 hour, we will upload the link and the YouTube schedule. And tomorrow, 300 MCQs full-scale grant test. We divide that into 50 questions, 6 blocks. Starting from 10 a.m. in the morning, we play the 6 blocks, right? So entry fee into each of this block is 25 rupees. So we will host those sessions. So you pay 25 rupees and then buy the ticket, go to the link and be ready. And when the game starts, you can play, right? So Manasvi is saying, sir, please give free tickets to already winner to increase competition. By paying 25 rupees or 50 rupees, Manasvi, you won't become poor, I won't become rich. But yes, to a lot of staff, I need to make pay salaries who are waiting for me. Past 2 months, I could not pay the salaries. Probably that 25 rupees or 50 rupees of you makes a great difference. So please pay and play the quiz. Huh? So, and also bring more of your friends. Now, doctor, low calcium, low phosphate with a high PTH. Very interesting question. If you answer this correctly, you are a super duper duper O. Yes. Low calcium, low phosphate, high PTH. Because high PTH is there, it is naturally what? Hyperparathyroidism. But if it is a low calcium, low phosphate, high PTH, that is a very important clue to differentiate. Now, the next question. Paget's disease. What do you see in Paget's disease? How will be the calcium phosphate in Paget's disease? Is calcium low, phosphate low, calcium low, phosphate high, calcium normal, phosphate normal? Only one of you correctly answered. Calcium, phosphate, both of them are normal in Paget's disease is what you need to appreciate. Very good. That makes Kim come very closer to catch up with 40,000 rupees of prize. And Bhavya need to save the trophy. So in malabsorption, there is a low calcium, low phosphate, high PTH. Renal failure is a phosphate retaining condition. So low calcium, high phosphate, high PTH. Paget's disease, normal calcium, normal phosphate. That is what you need to emphatically remember, doctor. Now, fever, left lower quadrant abdominal pain, signs of peritoneal irritation like muscle spasm, guarding, rebound tenderness. What is your diagnosis, Dr. O? 2 of you have correctly answered. Acute colonic diverticulitis. It is not the right upper quadrant, it is the left lower quadrant. That is the place where you have colon. Unlike cholecystitis. That is a very simple question and easy question. Very good. Kim and Bhavya have taken 2 swats and fighting to become a winner. Right? Now, the next question. Colonic diverticulae. They are most common in which location? Most common in which location? Is it ascending colon or sigmoid colon? Ascending colon or sigmoid colon? It is actually, I think, sigmoid colon was not given in the options. I'm sorry about that. So, sigmoid colon, they are most common. Now, the next question. Yeah, Bhavya, sorry that that option was not visible. Intestinal polyps, hyperpigmentation and alopecia with the absence of fingernails. What is this syndrome? Oh, only 2 of you are right. That is classically Crooked syndrome. Crooked-Canada syndrome is what you need to remember, which is associated. These are all the syndromes associated with colonic malignancy. Now, the next question. Hematomas with increased risk of bleeding, especially in a child presenting with rectal bleeding. What is the syndrome? Is it Turked or is it Cowden? Most of the times the fight will be between 2 options. 3 of you have clean bold. Turked syndrome is the correct answer. Wow! Kim has got up. Bhavya, you need to take a big shot. And the winner of this quiz, even if 1 student plays also, no worries. The winner will get 40,000 rupees worth of onlineMBBS.com, 3,000 video lectures, 65 full-scale grant tests, 1 lakh PowerPoint slides of notes, and 30,000 questions topic-wise classified Q scanner, and daily live online classes. Everything a free access. If you're already a topper, you can gift that to your boyfriend, girlfriend, or a boyfriend's girlfriend, or a girlfriend's boyfriend. Anything. So, doctor, let us see who is going to take that 40,000 rupees of free. Adenomatous polyposis coli gene is on which chromosome? Is it 3 or 5? 3 or 5? 3 or 5? Who is going to give me the correct answer? Yes. Adenomatous polyposis coli gene. Very good. Only 2 of you are right. It is chromosome 5. Such things you should not do wrong. That keeps Kim really racing forward like a Mercedes Benz. Now, what is wrong about Hirschsprung's disease? Is the dilated segment is aganglionic? Do you want to do full thickness or partial thickness? Or is it a mutation of red oncogene? Wow! Only 1 of you correctly answered. The dilated segment is not aganglionic. Contracted segment is aganglionic, and normal segment is, which is having ganglia intact, that is the one which undergo dilatation. It is a full thickness surgical biopsy. Yes. Red gene. Yes. That's what you need to understand. Very good. That keeps Kim on the top and really moving forward. Excellent, doctor. Now, the next question. Acquired megacolon. Where do you see? Punch your answers, doctor. Good to see 34 online. I'm really sorry you are unable to make it to the quiz, but you need to buy the ticket and be ready when the show starts. The moment you go to buy the ticket link. It will, you need to pay 50 rupees or 25, whatever the game's price. And once you do that, you will get a downloadable image. In that image, you will have the link which you can use to play the game, right? So any problem after you bought the ticket, you can send, you can call our helpline anytime. But please buy the ticket and play the game, enjoy the game, become a topper. And if you become topper, get 40,000 rupees worth of subscription to onlinembbs.com. So once more, I want to tell you all, evening at 7 p.m., we have a rapid fire 30 MCQ quiz at 7 p.m. broadcasted today evening. And tomorrow we have 6 quiz shows, each containing 50, 50, 50, 50, 50. 300 MCQs of our full-scale grand test is divided into 6 quiz shows. Tonight we will upload both the YouTube broadcast link, payment link, both of them. So you can be able to join and play the quiz. But each show is only 25 rupees, small ticket. You can buy and instantly you can pay, see how good you are scoring. Because a lot of us, we subscribe to the online mock test, but we really don't consume them because we think postponement is some kind of a postponement booth will be sitting in our brain. I want to clean that booth out of your mind. Okay? So all our Sunday tests are going to be instant coffee. Play the quiz, finish the discussion as and when there only, and play it like a game rather than like an online test. So that way you are able to meet other people who are also competing and playing the quiz, right? So now, doctor, the next question. Very good. Kidney is on the top. Ogilvy syndrome most commonly affects which part of the gut? Is it sigmoid colon or cecum? Sigmoid colon. Very good. Savan Bivgade is asking, sir, how do I increase my grand test series score? It is only by practice and practice of more and more questions, and 953 high-yield topics are there, doctor, in the onlinembbs.com video library. एक मर्तबा एक painting करना ही पड़ेगा. And Sarang, you are always welcome. Every day you have many quiz tournaments on this YouTube channel. Now I am pulling a lot of teachers. We have 4 to 5 great orthopedic teachers, another 4 to 5 great obstetrics teachers, radiology teachers. Down the line, I'm foreseeing almost every hour one quiz tournament broadcasted, so that we will keep you on your tenterhooks to prepare for the exam without any setback. Wonderful. So Navina is asking a question. Sir, I have subscribed to Online MBBS, but tomorrow quiz should the subscribers pay? See, the point is there is one online test available for you. For answering that online test which become hosted tomorrow evening, you don't need to pay because you're already given subscription. But to play it like a quiz in the morning, you need to pay a small fee, 25 rupees per each 50 question, each block, right? So that way what happens is, it's like a hall ticket. You are buying a hall ticket, you are having a time limit, you are having an adrenaline rush, and you are answering along with everybody, and you are attending the discussion. Wow. For that experience, you need to pay the 25 rupees of a small ticket. You can bring more of your friends. Once upon a time, I used to have 700, 800 students sitting in a huge hall. And even those Sundays, we used to, they were all those days of paperback exams. But 9 to 12 they used to get test, 12 to 3 we used to have discussion, end of the discussion they used to get that aha feeling of preparation. That is what I want to bring back with these online quizzes. Even the Sunday grand test, we will try to divide it into 650 MCQ blocks with some breaks in the middle, so that you are enjoying a completion of the 300 questions. That is important. All of us enroll in a lot of online tests, but we really don't get motivation to solve them. That is that I want to take out that inertia out of you. Now, doctor, excellent. Kim is on the top. The cecum is most capacious part of the colon. It is often massively dilated and become very tender in the intestinal pseudo-obstruction, which is called as Ogilvie syndrome, is what you need to remember. Now, doctor, hyponatremia is a complication of which surgery? Hyponatremia. Is it TURP or hysterectomy or radical nephrectomy? It is a complication of which condition? Wow, very good. Two of you correctly answered. It is the TURP, is what you should remember. Today, Kim's lucky day. Every day, Kim was almost reaching to the top. I thought the North Korean president Kim Jong is going to get the 40,000 rupees of jackpot onlinembbs.com subscription prize. Every time almost he is reaching, but last 4 or 5 questions he is losing the luck. Today Kim is a lucky guy to jump in. Just by investing 50 rupees of ticket, he is able to get 40,000 rupees. He may get, we don't know. Still there are a few questions. Good, Kim. Now, the next question. The most common cause of the bladder outlet obstruction in the men who are older than 50 years of age. Is it BPH, prostate cancer, or bladder stone? Always options are very tempting. So, Omkar is saying, hello sir, a big fan, wanted to ask, we can pay internationally. Why not? Any international credit or debit card, it will accept. Right? Even though it is 25 rupees, 50 rupees also, it will accept. No worries. If you have any problem, Omkar, you can always call 9000-868-356 to get into this. So BPH, doctor, not prostate cancer, is the most common cause of the bladder outlet obstruction. Now, very good. Kim is going very, very fast. Now, last 8 questions in this rapid fire. Carcinoma prostate, from where does it arise? Is it peripheral zone or periurethral central zone? Peripheral, periurethral, peripheral, periurethral. Always, you have to be precise. No, 2 of you are clean bold. So it is the peripheral zone from where it arises that makes Kim to crack 968. Even Bhavya also is correctly answered this question and scored 82 points. Whereas Kim scored 84 because he answered faster than Bhavya. Good, Bhavya. So the next question. In older people, hydrocele is frequently the result of what? Is it because of inguinal hernia or failure of obliteration of the process vaginalis, or is it epididymoarthritis? Wow. Only one of you correctly answered epididymoarthritis. Older people. Anubha Singh has correctly answered. Excellent, Anubha. So I want to see all you guys once more in the evening, 7 p.m. Quiz, which we will upload the YouTube streaming event and the payment link in another 1 hour. Okay, so that's good. Oddity is really going fast. Sorry, you joined little late. Otherwise, oddity also had a good chance of being top. What is wrong about spermatocele? Be very sure. Is it unilocular retention cyst? Is it always in the head of the epididymis? Does it have barley fluid? Can't you trans-illuminate hydrocele or spermatocele? Both of them you can trans-illuminate is what you have to emphatically remember. Whoa! All of you correctly answered, but Kim answered fastest. He's a North Korean president now, isliye. So a spermatocele is a diverticulum of epididymis. It has the cloudy fluid with spermatozoa. It is unilocular or multilocular, and it can be trans-illuminated, is what you need to remember. 4 more questions. What is the most common tumor of the testis? Most common tumor of the testis. Is it seminoma, lymphoma, yolk sac tumor, choriocarcinoma? What is most common? Wow. 2 of you correctly answered, but 2 of you are confused. It is seminoma, doctor, seminoma. So Kim answered wrong. I'm surprised. Is there any match fixing between Bhavya and Kim? So that Kim wanted to give an opportunity for Bhavya to become a winner. Good, Bhavya. 76 points in oddity also is right. Now, the most common histological type of testicular carcinoma, testicular tumor, is which one? Most common histological subtype of testicular tumor. Yes. Very good. Only 1 of you correctly answered, that is mixed histology. Mixed histology is what you need to remember. Wow. Only oddity correctly answered. Excellent. Now, the most common testicular tumor in infants. Boom, boom, boom. Seminoma, lymphoma, yolk sac tumor, choriocarcinoma. Infants. 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 Whoa! Only 2 of you correctly answered. Yolk sac tumor is what you need to remember. That's good. Kim took a machine gun and fired 90 points. Anubha Singh is also right, but little slowly answered. So, see, when you are competing, you are guessing, you will remember it forever. Tomorrow's exam also you will correctly remember. That's the point. You need to play the quizzes. Tumor in an aged elderly person. What is the most common tumor? Oh, the answer is there only. That is lymphoma is what you need to remember. Very good. All of you rightly answered. So the last question deciding the winner of 40,000 rupees. Yes, the most common malignant testicular cancer. Seminoma, lymphoma, yolk sac tumor, choriocarcinoma. Who is going to take away that 40,000 rupees? 3 of you are right. Excellent. Very good. But fastest machine gun firing is from the King. King Jong Jr. Jindabad, Jindabad, Jindabad. Excellent. I hope you all have enjoyed this wonderful rapid fire this afternoon. Oh, is it Manasvi who is the king? What is the actual name of our Kim Jong Jr.? So very good, Kim. Just take a snap of this and send WhatsApp it to our helpline 9000 868 356 Very good. Auditing. Thanks that we are able to pump adrenaline out of auditing and all the other players. Once more at 7 p.m. We have the 30 MCQ. Some of them are image-based questions. A rapid fire session going to start today evening at 7 p.m. And I also want to tell you guys that yes, I want to tell you guys that tomorrow, Sunday, full-scale grand test, 650 question MCQ rapid fire block. Get the adrenaline push and solve the grand test paper along with everybody else. Every block, 25 rupees is the entry ticket. Invite your other friends also. Beforehand only, please buy the ticket and get the link of game and then play and enjoy, right? So thank you very much, Kim and everybody, for joining. And yes, and see you all today evening. Ta-ta and goodbye. Don't forget to buy the ticket and join the game today evening.